Doctor, tell us about osteoporosis and who's at risk.
Osteoporosis is a chronic progressive disease that is defined by weak bones and can be caused by too much bone being lost, too little bone being formed, or a combination of both. Osteoporosis literally means porous bones, and bones weaken over time, becoming thinner and more brittle and more likely to break. There are 10 million Americans with osteoporosis in this country, and an osteoporotic fracture occurs every 20 seconds. So if you think about the math, that is a lot of people who are at risk.
That's huge. Now, is there a certain age that we should be worried? What about younger people?
I think we should all be concerned about bone health throughout the course of our lives. We reach our peak bone density at about age 30 and then gradually start to lose bone after that. But there are risk factors that put us at risk for osteoporosis and having a broken bone, and those do include age. So with increasing age, the risk becomes greater. Family history or genetics is important, especially the history of a hip fracture in mom or dad. People who are of low body weight, and anyone who's had a prior fracture as an adult, because once you've had an initial fracture, that doubles your risk for a future fracture. And then, of course, there are lifestyle factors like smoking or excessive alcohol intake that can also put people at risk.
So do we see an increase in this, doctor?
Excuse me?
Do we see like an increase from years ago osteoporosis now, or just that we know more about it?
I think it's a combination. We certainly know more about osteoporosis, but when you think about the aging of the population, baby boomers having come of age, as people are living longer, clearly there are more people who are potentially affected, and because fractures can be a life-changing or life-altering event, we really want to be proactive and do things to prevent bone loss so that we can continue to lead healthy, active, productive lives.
Now, can you give us some early signs? I mean, you mentioned earlier about, if you've had a fracture already, that it compounds for next time, but what are some of the early signs?
Well, that's a great question. Part of the problem is osteoporosis is generally a silent disease until somebody has that first fracture. So it's painless. We don't feel it at first until there's a break. That's why we need to be so aware of risk factors and also speak with our healthcare providers about whether or not we need a bone density test. A DEXA or bone density scan is a non-invasive, painless test that can help measure bone density. The lower the bone density, the greater the risk for fracture. So we want to make sure that we're being proactive to detect bone loss and think about people who are at risk so that then we can intervene before they have that first break.
Now, children, of course, break bones. Does that make it higher susceptible for them also to have osteoporosis when they get older?
When we generally think about a prior fracture being an issue, we're usually talking about a low trauma fracture in an adult, so somebody over the age of 50. But if we have younger people, certainly who have multiple bone breaks, sometimes kids are just kids, right? But whenever somebody has had multiple fractures, I would advise them to speak with their healthcare provider who can better assess if there's something else going on and what the future may hold for them.
Now, where can adults get bone density scans, and is there a certain age, or should there be risk factors first we're looking at, or early signs?
Bone density scans can be done in an outpatient setting, in a healthcare provider's office if they have the appropriate machine, in a hospital setting, in a radiology setting. So I would advise people to speak with their healthcare providers about where the most appropriate place is for them to get the test. Women age 65 or older and men age 70 or older, if they've not had a previous scan, are candidates for a bone density test. And younger postmenopausal women and men, if they have additional risk factors, would also be candidates for a test. So again, the best idea is to speak with your healthcare provider who can help determine what's best for you as an individual.
Great. For those with osteoporosis, why is it so important to reduce the risk of breaking a bone?
It's so important for us to reduce the risk of breaking a bone because once somebody has had that initial fracture, they're at double the risk for another fracture, and the more fractures one has, the more likely it is that they'll break additional bones. And a fracture or a broken bone can be a life-changing event. People may no longer be able to do the things they normally do to live independently, and we want to ensure that people have the best opportunity to live healthy, active lives.
Now, where can our readers go for more information to learn more about osteoporosis?
For more information and to take a 1-minute assessment of bone health, people can go to the International Osteoporosis Foundation website. That's www.iofbonehealth.org. Or they can go to the National Osteoporosis Foundation website, where there's a wealth of information, and that's nof.org.
Now, is there anything we can cover in this interview, Doctor?
I think you've asked some great questions. I would really encourage patients to be proactive when it comes to their own health. Speak with your healthcare provider about what your own risk factors might be, about whether or not you need a bone density test, and certainly if you've already had a broken bone as an adult, make sure that your healthcare provider is aware so that you can be properly investigated and treated if needed.
Thank you so much for your time today, Doctor.
My pleasure. Thanks for having me.